Bring in our guests. Pete Sessions is the congressman from Texas sitting on the House Oversight Committee. Plus, Jelena Olmstead is the CEO of Lavaris Global. Really appreciate your joining us. And also, thanks for raising awareness about this issue, because I think a lot of Americans don't truly understand how fraud like this is occurring. I'll start with you first, Congressman. I mean, talk to us about this increased spending with respect to the skin substitutes.
Thank you very much. As the chairman of government operations, we have looked at the overspending during the Biden administration of some $2 trillion. The Government Accounting Office, GAO, said it was $500 billion a year, literally for 4 years. During that period of time, we found out that what happened is the Biden administration did not have government employees at work. They worked from home. We were told, oh, home is more efficient and effective. The bottom line is that it allowed people who normally would interact with the government and the government to be at work, to look at reports, to look at the amount of money that was being spent, and it would allow them a chance to get ahead of the curve instead of waiting the 4 years. So that's exactly what happened. Now we're attempting to look at what that fix might be, and the Trump administration looked at exactly the numbers and then said, okay, we got a problem. We're going to drastically reduce the amount of reimbursement. And then that causes issues that you're going to hear about now from the marketplace. People who have senior citizens, my constituent and others, many who are in nursing homes, who then would have to be transferred to a hospital because the wound care availability was underpriced and underpaid. Jelena?
Yes, so, the patients before COVID did not have access or proper access to all treatments that had chronic wounds, which is millions of Americans, most of them elderly, many of them diabetic. We think that access to health care and access to proper wound care is a positive thing. And as Market, we had come to the administration many times to fix the payment methodology. It was not done in the previous administration. We applaud the current administration for doing the right thing, but we do think that it needs to still have some guardrails, and there should still be some work to ensure that we're now not limiting access yet again to the patients who really require this most. Many of them, as we stated, at home, in nursing homes, and in rural areas that with diabetic foot ulcers, they can't exactly walk into a doctor's office every week.
Representative Sessions, my brother, who's a doctor and in health insurance now, says he told me about a couple of years ago that he kept on seeing this increase in doctors who wanted to bill for skin substitutes. And he said it was very, very expensive. And he was always going back to them and questioning, why do you need to do this? And so can you talk to us about this? Because I understand that the spending just on these skin substitutes has skyrocketed from a few millions to billions of dollars.
Well, let's go first to the issue. There are people who are in people's homes who are healthcare providers that are not trained. They're not certified in wound care. They may see this when they come to a patient, perhaps over heart issues or over issues with their digestive system or diabetes. And they happen to then see these because they coexist. As open wounds happen during diabetes, as they happen over bed sores. So there are people that come into contact with it. That is not really the issue. The issue is the reimbursement level. And so there are people who were treated and the provider charged the government millions of dollars for one patient at a time. That is because the guardrails that should have been in place during the Biden administration were not, and it caused this dramatic spike. I can't say the percent, but a huge percent of the people who do provide this service do so properly, and they were not the culprits. The culprits were people who would charge 1,000 times the amount of money that was typical for these types of changes and services that were rendered. So it was the very typical thing, 2% of people ruined it for the rest of everybody else. Now, the Trump administration is taking feedback. They're giving guidance, and I think that they're open to it. And this hearing that was held had people from the marketplace who see this. You see, we still have bed sores. We still have problems. So they're getting a handle around it, and we were trying to help them.
All right. Congressman Sessions and Jelena Olmstead, thank you very much for being with us.
You bet.
Thank you for having us.